Trauma is typically an adverse event that someone either witnesses or experiences that has them feeling like they are in danger or that their life is at risk. And trauma can look like separation from a parent. Trauma could be witnessing domestic violence. Trauma could be witnessing or having violence perpetrated on yourself personally. There are many different faces to trauma, but those are just a few examples. So when we think about trauma as it relates to schizophrenia and Black Americans, we really are thinking about ultimately trauma as it is a result of systemic or institutional racism, where people who are marginalized in this way are more prone to live in environments where there's violence and there's a lack of safety. They're less likely to have access to good, reliable health care. Typically, we see, in these communities, there is separation from parents, either due to incarceration or loss of life. And then also there is just the trauma and the stress of racism personally, being discriminated against, having brutality perpetrated on you and violence as a result of people's bias. When you are subjected to chronic trauma, there's chronic persistent stress, and that is damaging to one's brain. It definitely impacts the areas of the brain that allows us to regulate our emotions. It impacts the part of the brain that allows us to be able to focus and concentrate. And over a long period of time, it also impacts our physical health. So our ability to sleep, our ability to regulate our emotions and our behaviors. It predisposes us to heart disease, high blood pressure, and all of these physical and mental changes or experiences are the result of chronic and persistent stress. When we think about the risk as it relates to Black Americans and the risk factors that are due to, racism and trauma, the preventative approach would be thinking about how we create safer environments. How can we create safer communities? How can we create greater access to care? How do we decrease the violence? There are definitely resources within the community that may be able to help manage some of the stresses that are due to the trauma. Seeking advice or guidance through your primary care provider or mental health provider, if you have one, can also be a resource to be able to address the exposure to trauma that you might be experiencing.